Welcome back to DP60. Today, instead of a CPC, my first year dermatology residents asked for some derm path basics. So we're going to cover some basic terms for just spongiotic and psoriasiform reaction patterns correlating to eczematous and papillosquamous reactions clinically today. First term is acanthosis. Acanthosis means hyperplasia or thickening of the epidermis. Regular acanthosis classically is seen in psoriasis, where the thickened epidermis, these rete, come down to one line for the most part. There's always some exceptions, but this comes down to one line. That's regular acanthosis. On the other hand, irregular acanthosis, which is seen in lichen simplex chronicus, is where the thickening of the epidermis is irregular. The ends, the tips of these rete, the base of the epidermis comes down to different lines. That's irregular acanthosis. Hyper or hypogranulosis refers to how much of a granular layer you have. Hypergranulosis, it's increased. Hypogranulosis, it's decreased. So for spongiotic or psoriasiform disorders, hypogranulosis, a diminished granular layer, basically there's almost no granular layer here, is seen in psoriasis. Parakeratosis is retained nuclei within the stratum corneum, and this is a papillosquamous disorder called Pityriasis rubra pilaris, where you have beautifully retained nuclei here within the stratum corneum. Here's orthokeratosis, and here's parakeratosis. And in PRP, Pityriasis rubra pilaris, there's this classic alternating para, no para, para in a checkerboard pattern. Spongiosis just means intercellular edema within the epidermis, and this is seen in many processes that are so-called eczematous clinically. And here's stasis dermatitis as an example, and here you can see the intercellular edema. So to sum up, all of these terms are very important for when we describe inflammatory reaction patterns of the skin, especially spongiotic or clinically eczematous lesions, and psoriasiform or clinically papillosquamous lesions. For spongiotic lesions, the epidermal intercellular edema or spongiosis corresponds to clinically weeping lesions that may be crusted or wet appearing. And psoriasiform lesions correspond to clinically papillosquamous lesions where there's thickening of the skin with overlying parakeratosis that produces clinically elevated scaly lesions with usually very dry scale that might be white or yellow in color. And these elevated lesions, the papules and plaques, are often very well demarcated from the surrounding skin. Thanks for listening today.